Hi everyone, thank you very much for your interest in my talk today. I'm going to be talking about looking at the developmental outcomes for children attending a new community-based preschool model in Timor-Leste. This is part of a much larger project, the LINKS project, which was funded by the National Institute for Health Research, and it's the Global Health Research Group on Early Child Development for Peace Building or Social Cohesion. I'm representing my colleagues today at Queen's University, at Ulster University, where our principal investigator, Professor Paul Connolly, is based, and of course our wider research team in Timor-Leste, who are in Dili. So if I just go on to give you a bit of background here, like I said, this work is one slice of work that we do in Vietnam, Timor-Leste, Mali, Egypt, Kyrgyzstan, Tajikistan, Colombia, and Palestine. So because our time today is short, we will just be focusing on developmental outcomes among young children in Timor-Leste. But like I said, at the end, I'll be providing information where you can get in touch with any of our team, but myself as a first point of contact if there's anything else you'd like to know about. So we know that there are about 250 million children younger than 5 years of age in low and middle income countries who won't stand a chance in terms of meeting their developmental potential. And of course, we know that we need to do something about this. We also know that a multi-sectoral, interdisciplinary, multidisciplinary approach is needed to address some of these issues. So there's no point in just looking at health or nutrition or education. We need to look at everything together. To focus more on Timor-Leste, Timor-Leste has a population of about 1.2 million. And of those, there's a majority of young people, so about 60% of the population is aged between 15 and 24. Among the mortality rate is absolutely dreadful, around 44 per 1,000 live births. Stunting is a huge issue, with 1 out of every 2 children experiencing stunting. There are also issues with wasting and low preschool enrolment rates, particularly in rural areas. So preschool enrollments currently stand at about 24%, and believe it or not, that has improved greatly in recent years, but it's still not anywhere near where it should be. But there are glimmers of promise. So colleagues who've joined in with us in helping to do some of this work in Timor-Leste have been finding that early education programs were associated with improved cognitive outcomes for young children in the region. Now, our focus is very much around early child development and social cohesion. But we thought, we'd join forces with this team and with our colleagues in UNICEF. The other thing worth mentioning is that we have academic partners in the US, in Yale, Harvard, and NYU, who have vast experience working in the areas of ECD and social cohesion. So they were also able to join in with our network. Another important thing to point out is that in each of our country settings, we employ 3 researchers from each country setting from their own country, with their own expertise and their expert view on priorities needed for research in their countries. So we started off from a strong place. So the community-based alternative preschools. In Timor-Leste, there already exists a public preschool curriculum, but UNICEF since 2015 had started to roll out these community-based preschools to address need where there was no existing preschool provision. They have a manualised curriculum, so they focus on literacy, numeracy, socio-emotional and physical development, but there's a really strong focus on Timorese culture. And there was a very strong emphasis on play. And some of this was down to our partners here in Northern Ireland, early years, who came with us on the journey and helped to bolster programmes before we set out to evaluate them. Now, the alternative preschools happen for about 7 hours per week. And this is important because the existing preschool offer is 20 hours per week. So this is a bit less, but again, it's at the beginning of its journey. Communities play a huge role in the running of these settings. They're run by volunteer facilitators. There's also a parenting support programme which runs alongside the preschool, and this sets out to improve parenting practice, but also to engage parents in their children's education from very, very early on. And we have findings on all of this, but again, we're not presenting on that today. So we set out to evaluate what, if any, impact the community-based alternative preschools were having. Business as usual were the public preschools. The programme is funded by H&M Foundation. And on the advice of UNICEF, we carried out our country visit and situational analysis before we ever started work. And this was so helpful in terms of getting to meet stakeholders who are now very receptive to our findings, but to make connections and get to know what provision is like on the ground and to understand challenges, barriers and facilitators to our work. So on to the evaluation. So we wanted to look at the pre-existing public preschool provision and compare it with the new alternative preschool provision and look at our early child development outcomes. So you can see here our children were all around 4 years old. We had about 607 children took part, slightly more girls than boys. And the municipalities or SUCOs were Ermira and Vikeke in Timor-Leste. But the actual schools and the communities around the schools are in the villages or aldeias, where the community gets very involved in the delivery of the programs. So in order to measure child development, again, our colleagues, Rao et al. Had been using with great success the East Asia Pacific Early Childhood Development Scales. And you can see how the subscales or domains within this map onto some of the elements of the curriculum of the actual program in schools. So right from cognitive, social development through to motor development and that cultural aspect that was so important in Timor. Our Rao also helped, her and her team came to Timor and helped with training and getting fieldwork off the ground. And in terms of capacity strengthening, this is brilliant because we now have teams of field workers and some great training in place should we be able to scale up in the future. So at baseline, so before the children had exposure to their preschool programs, you can see here that the existing public preschool group are doing very well on these domains in the East Asia Pacific measure. And if you compare them to the new community-based alternative preschool here, there's quite a gulf between the two. And you can see over here to the right, there's a significant difference between performance of the children in the public preschool versus these community-based alternative preschools, which again, the new preschools tend to be in those underserved rural areas, okay? So this is where we started out. And then 9 months later, we carried out the post-test and we were stymied somewhat by COVID and various things along the way, but we did manage to carry out the post-test. And what we found then was that you can still see here that there is an advantage that the public preschool children are still doing somewhat better than the community-based, the new preschool children. But over here on the right, you can see only 2 of these domains are now significantly different. So it looks like the community-based children, they have closed the gap. There's not so much difference between them and their public preschool counterparts now. So what can we say about the new community-based alternative preschools? Well, despite the differences in dose and infrastructure, the children in these new preschools appear to have closed a developmental gap between themselves and their public preschool counterparts. It's worth noting that the public preschool children tend to have a dedicated premises, where the community-based alternative preschool children have to avail of community centres and homes that are often used for many other purposes. And yes, the public preschool children were still outperforming the alternative provision comparators at post-test, but to a much lesser extent than at baseline. And you can see from the results presented that post-test, there were only 2 domains where the public preschool were significantly outperforming the new preschools, and that was in motor development and the cultural knowledge and participation domains. So this demonstrates, as far as we're concerned, the potential for UNICEF's community-based alternative provision with some refinements. It would be great to see more content, more contact hours, to really even up that playing field, get the dose up, and also perhaps to test at scale using a randomized control trial. I mentioned capacity strengthening earlier, and it's great now because we've learned a lot, we've grown a lot with our team in Timor. We now have a fair bit of expertise in the measures that we used, both for this and our social cohesion. We also collected a great deal of other data, qualitative data, social cohesion measure data, and we are working with our colleagues in the Harvard Humanitarian Initiative, who are collecting and storing all the data and measures that we use or develop in Kobo Toolbox, which is well worth a look if you're interested in some of the work that ourselves and colleagues across the globe are up to. So that was a quick overview of this slice of our work. If you want to get in touch with me, I can signpost you to further information about any of our projects. If you'd like to find out more about the links, bigger program of work, you can access our website. But for now, thank you very much.